Hi guys, Dr. Cartland here. Absolutely hate doing these videos as I'm not a camera sort of person. However, just reached the point really where I just wanted to tell a bit of my story, since I think most of you know my story up to a certain point, but sadly due to censorship the story's been kind of kept away from public eyes essentially. So really just to start with, to say that from the perspective of my qualifications, I have a first class honours degree in biomedical sciences, including a year of immunology and virology, 10 years worth of medical training with 15 years of postgraduate experience. However, it's come to be during this pandemic that unfortunately these qualifications don't seem to warrant me to have an opinion on things. So very early on, all I've ever asked for really in my fight against firstly ethics, basic ethics around consent, informed consent, bodily autonomy, and not coercing people to take any sort of medical treatment, vaccine or not a vaccine, is just not part of what we do. The second thing is obviously when they started vaccinating healthier and younger people to the point where they were vaccinating against the medical evidence really, children and pregnant women, despite their own advice, and I'm talking about sort of JCVI and the MHRA. They've been publicly, they've documented that we shouldn't be vaccinating these groups yet. The risk-benefit profile is not conducive with that. However, they proceeded, and now they're after 5 to 12-year-olds who are at negligible, minuscule risk of any sort of deaths. I won't quote all the data because it's out there and available. And the consequences of that really in my career is that obviously I was put on garden leave for 3.5 months just for asking for debate, asking for discussion, pretty much shunned by all the nurses, doctors that I know in this area. And then it became a kind of social media shunning. So as we stand now, I've been banned from LinkedIn. I've been banned from Twitter 4 times over now. Facebook, I'm on again another 30-day ban. And Instagram, when you look for my name, it says I'm a persistent spreader of misinformation or words to that effect. And that just isn't fair really. Not only is it slanderous, but all I've ever done in all those social media posts really is post data contrary to the narrative so that people can make informed choices and judge things for themselves, unfortunately, not given that information from the healthcare provider who is treating them with this injection. So yeah, just to let people know really about the censorship and just something that happened yesterday really that's really upsetting. I've started a new job at an urgent care centre, and I went onto the shift yesterday. It was absolutely blazing sunshine. I'd driven an hour and a half to get into work, and I saw my first patient, who was an old lady who was in her 80s, had sat there for 6 hours. I saw her swiftly, discharged her, and as I was doing the paperwork, I had a tap on the shoulder from the matron who basically advised me to wear a mask. My response to that was that from previous wearing of masks, I get dizzy, I get drowsy towards the end of the shift. They're expecting me to wear this mask all through the shift in the department. And if I didn't wear the mask, then I would be asked to leave the shift and leave the service. Now, at the time, there was me and another doctor on, and I was due to be on shift for the last 2 hours alone, and there were 17 patients waiting to be seen, I think. So I asked about my own personal health and safety, given that they make me ill. That didn't seem to matter. I asked for the evidence for the policy. I asked to see the policy, and again, none of these were responded to, other than if you're not going to wear a mask, you need to leave. And that it was my choice to not wear a mask. I'd had a COVID test that morning, which was negative. All the patients and doctors were, by their own choice, wearing a mask. So me having not got COVID and not wearing a mask is, I'm only a risk to myself, if anyone, and that's a personal decision and my right as a human to make that decision. So I still can't get over that. Anyway, that was confirmed by the clinical director and I was asked to leave the premises. Interestingly, I've been allowed to work today in the same trust in a different role, which just absolutely makes a mockery. Why am I a biohazard in one building yet not a biohazard in the other? And they're aware that I'm not going to wear a mask today. So just to let people know that that's happening. It's doctors that are speaking out about vaccine injury. There's a lot more public and doctors and nurses that are fully awake privately, and I say privately because given my own experience, it's not been fun, given that I've had a GMC hearing about my social media presence, which came to nothing, an NHS England input, which came to nothing. But given the fact that people are probably petrified for their careers, their financial incomes, I can kind of understand why they don't speak out, because of that really, and the sort of shunning that I've experienced is a good reason as to why people haven't made that bold step really. So all I will say is that there are a lot of us, albeit many of them are privately agreeing with me. I've come off a Zoom call today with two people who are in an office on their own. One of them's got a mask on. Just incredible how people are not consulting their critical thinking and thinking about evidence for the things that they do. That's what we do as doctors. We are people who represent the evidence base as it currently stands. We should all remain up to date. The amount of doctors that haven't heard, for example, of the Pfizer dump, they're not aware of the statistics around the different vaccine cohorts and the outcomes of spreading transmission, and the outcomes of emergency admissions and deaths being higher in the vaccinated cohorts across the board really in lots of different countries, and just being completely unaware. And to me that is just clinical negligence when they're responsible for being up to date with current medical practice and data. So yeah, I'll leave that with you guys. Like I say, I don't do these videos very often, but just wanted to share that story with you, and just keep speaking out, speaking the truth. I know we all get treated like conspiracy theorists and that we're a bit crazy, but as long as you follow the evidence base and you can back up everything that you say, then there's no one that can harm you in that respect. So keep to the evidence, keep to the facts, and keep up the fight, because this is dark really. If what we're seeing going on is really true, and I've said from the very beginning that I wish and hope and pray that I'm wrong on what I'm seeing, but for me it's beyond all reasonable doubt that these vaccines are dangerous, without a doubt. And just not being acknowledged. I know GB News did a thing on vaccine injury yesterday, but it's the first time really. I can tell you firsthand, having spoken to many vaccine injured, there's some horror stories to be told, and they're just not given a space. They're just ridiculed, shunned, put into the shadows of society as if they don't exist. Likewise the doctors who speak out about it. So it really is dark times, and just giving you this video to give you an update. So all the best everyone, take care, and keep up the fight, keep telling the truth. One stop jab is worth all the effort in the world. So all the best, take care.